Good morning. We are here with This Week in Digital Health, and we're here today with the Gilles. Gilles, how do you pronounce your last name?
Lunzenfichter.
Yeah, that's why I didn't even try. So, Gilles is CEO and Chairman of Medisanté. Can you tell us a little bit about Medisanté and what you guys are working on?
Yes, so we are on a mission to empower connected care by making the Internet of Things work for caregivers. I think there are a lot of sensors around today in a consumer world for self-monitoring, but with the pandemic now, there has been an emergence of telehealth and increasingly remote patient monitoring, where it's really the doctor, the care team that is in the driver's seat.
Yeah, I know one of the challenges we've worked with clients, and one of the challenges that we've ran into, we went and worked with a hospital in Berlin, and that hospital had 69 data silos just in the one hospital, right? So they just did not have the ability from one department to another to communicate. So why are these data silos such a problem?
Well, of course, data silos between within the hospital or within multiple hospitals are a major issue. It's an interoperability issue. But what we really address is device interoperability outside of the hospital. So how do you make sure that a patient who is, let's say, hypertensive or diabetic, how will you make sure that in a very easy, in a very smooth, in a very seamless fashion, his readings will land on the screen of a health IT system of the hospital in Berlin? I mean, how is this possible? And that's exactly the issue we have addressed. We have made this global interoperability between devices anywhere in the world and health IT systems anywhere in the world totally seamless.
And what that helps to do is eliminate having to have disparate systems running, to check, different types of data coming in from various devices.
Yes, if you put the patient in the center, which is really what is happening in real life, patients, when they are elderly patients, often those who are most in need of virtual care, remote patient monitoring, very often these people are multi-morbid patients. So if there is a remote patient monitoring program, there are many of them right now in the United States, and it's an emerging trend in Europe as well. In fact, there is a need for the providers to collect multiple vital signs. And right now, all the device vendors operate in silos with my device is beautiful, my mobile app is beautiful, my proprietary device cloud is beautiful. But then this does not allow to land the data on the screen of the doctor in his own health IT system. And this is the issue we address. We break the device silos and make sure that a broad range of vital signs, blood pressure, blood glucose, temperature, SpO2, weight, and other vital signs really get sent direct to cloud, that is without the need of a mobile app on a smartphone in the home of the patient, to the screen of the doctor.
And what this allows us to do is to aggregate those data from the disparate pieces to present an overall picture, correct, of the patient health, because you can compare data points from, like you said, different types of devices, so that we have a better picture of the overall patient.
Yes. So what happens is that in the world there are initiatives right now where providers in healthcare want to do remote patient monitoring based on the data coming from those devices in the home. There is a lot at stake in terms of economics and also in terms of population health outcomes. 80% of the costs of any healthcare system across the world relate to chronic patients, chronic elderly patients. And if you can move the whole healthcare system from in-person encounters to virtual encounters based on real-world evidence, real data coming automatically from devices, these can have a huge economic impact because people can stay longer at home instead of going to the hospital when they are really aging. And in addition, you know, at the end, it's better quality of life for the patients. And frankly, having a doctor taking blood pressure of his patient in a physical encounter, it's nice, but in 10 years from now, this will no longer exist. It will be completely offloaded to the patient, and it will be an automatic data collection of blood pressure. It will land on the screen of the doctor in his own health IT system. And that's how the world will be in the future. It's the vision of hospital at home that will become a reality.
You know, I understand what you guys are doing and why you're doing this. Are the healthcare systems caught up IT-wise to be able to accept this?
Yes. So first of all, what we see is that there is an emergence of a new generation of systems that are not just a system that records in-person encounters within the hospital. It's really a new generation of modern health IT platforms that have been designed from the ground up to do either remote patient monitoring in the healthcare space or decentralized clinical trials. And those platforms are literally mushrooming across the world. They have either a focus on a specific country, or they have a global focus, and it will also be a focus area for some global tech companies to come up with such modern platforms where what is at the center is the digital interaction between a physician and the patient remotely. And so we started to see such platforms that have attracted millions and billions of venture capital money during the pandemic. Those systems have capabilities like video consultation, teleconsultation, chatbots to have this interaction between the patient and the doctor. But really the next stage where there is a real impact in terms of population health outcomes for the elderly people, and also an economic impact. It's really to collect data based on devices, which is what we call remote patient monitoring. So yes, there are multiple trends. The reality is that there are two transformations. There is a transformation that interactions between doctors and patients shift from in-person to virtual. And to do that, many hospitals, many providers are adopting new platforms on the clinical side that have been designed for such interactions. That's a fair point.
And are you seeing that adoption? Because, you know, we've seen that most hospitals will, you know, run a legacy system forever, you know, and are slow to adopt new technologies and new IT.
Yes, this is happening. The United States are at the forefront, and this is fostered by some reimbursement codes from CMS. So in the United States, you have specific CPT codes that allow doctors to make money if they take care remotely based on an automatic data collection from remote patients above 65. A doctor can make $1,500 plus if he puts in place the right technology end to end between the home of the patient, the telecom line that is required to extract the data from the home.
HIPAA compliant, right?
And of course, the patient data hosting needs to be HIPAA compliant in the US or needs to meet other regulations in Europe. And yes, so in the US, reimbursement kicked in 2019. So the US is definitely at the forefront. But other countries like Germany and France are also discussing at a very advanced stage changes in reimbursement policies so that doctors are incentivized if they do remote patient monitoring. And if these financial incentives through changes in reimbursement policies kick in, then it will create the shift, and then it's just about having the providers select the right technologies and going for the market opportunity. For instance, in the US, there is an assessment that if there is a new reimbursement code, a new CPT code, it takes 5 to 7 years until 50% of the providers really adopt that CPT code. So we are now in year 2 to 3. So things have started and should take an exponential, the curve should become exponential for next years. We are just at the beginning.
And is this sort of the silver lining of the pandemic, is that, you know, this has forced many healthcare organizations to finally address this and to move this into a cloud environment?
Yes, definitely. I think without the pandemic, the doctors would not have been convinced that their trade can be done remotely. You know, I've been working in software companies for 30 years. So it was pretty obvious like 10 years ago that it doesn't really matter, you know, if you do a Zoom conference, a Teams conference, you can discuss the right topic with your counterpart, do business with him remotely. But the healthcare and life science was kind of preserved so far. There was a lot of reluctance from the healthcare professional themselves. They mainly saw it as a burden that could even, you know, worsen the state of burnout that is a reality in healthcare. People are pretty much overworked. But the nice thing, if we can say that, of the pandemic, it triggered an awareness that when you have no other option, you become creative. And the pandemic kind of forced them to move to virtual encounters with their patients, because there was nobody in the waiting room. So, you know, they had to be creative. And now that they tested successfully teleconsultation, video consultation without using automatic data collection from devices, everybody understood that this is here to stay. And now it's just about orchestrating the changes in policies, which will take 5 to 10 years, depending on the countries. But it's inevitable for economic reasons to shift from in-person encounters to virtual encounters to collect real-world evidence automatically from devices in the home. And it's just a matter of time. And then, of course, it's not either or. The new model of care that is emerging is now virtual, but it will be a hybrid model that will combine care pathways, you know, both virtual and in person.
And you guys are sort of counter what we see in the market, in that everyone's out there building apps to accomplish this, and you've taken the app out of the equation. Can you explain that?
Yes. So what we see is that people most in need of virtual care, they are above 65, and I would even say with the aging of the population, they are rather above 75. So if the doctors, the providers get paid to do remote patient monitoring, they do not want to become technical support agents of Bluetooth connectivity and password resets of elderly patients at home. So there is a real need to remove any complexity in the home, and instead of relying on a mobile app on a smartphone, we have indeed gone the direct to cloud connectivity route, where there is no need for configuration of the device. It's a zero touch device configuration for the patient. He just takes his measurement and the data, the readings get sent to the screen of the doctor. And this is important to be inclusive. And it's also one of the learnings of the pandemic. A lot of consumer assumptions have been put in question. So, you know, you might think that everybody has a smartphone, right? Everybody is digital savvy to use it. Everybody has an internet connection. Everybody goes every day on Google Play to download the mobile app, configure it with the blood pressure monitor, enter the password, remember it, update the operating system on the smartphone, repair the blood pressure monitor with the smartphone, etc., etc. But this is consumer fiction that the smartphone device manufacturers would like us to believe. The reality is completely different. If you look at hard facts, what happens is that the picture is totally different. In the US, 40% of the people above 65 do not have a smartphone. So that's where this need for a direct to cloud connectivity emerge, because if you don't have it, in fact, all these people, based on their social determinants of health, are excluded from virtual care. So in the US during the pandemic, many people were excluded from telehealth programs, and direct to cloud connectivity is a way to be inclusive regardless of the social determinant of health of the patients.
And by taking the patient out of the loop, does that increase security and make it a more secure than, you know, sort of like, you were alluding to a lot of operator error and challenges and things like that. So does this create a more secure environment for this data?
Definitely. So it's not that we want to take the patient out of the loop, but at least we want to minimize the configuration complexity in the last mile, which is the patient's home. And so in order to make that work, in fact, we have built a vendor agnostic telehealth device cloud in the middle between all those devices that are connected direct to cloud and the health IT system. So the first thing we do is we connect our device cloud within 3 clicks to any health IT system able and willing, to my previous point, to collect vital signs, personal generated health data from the outside of the hospital, from the homes of the patients. And this is really a seamless 3-click type of interoperability, which is our core competence. That is one of our major achievements and our uniqueness to have this global and seamless device interoperability with health IT systems across the world. And so once this is done, what is completely different, and this has a huge impact on the security and the privacy, is that the way the device gets assigned to a patient is part of a medical workflow. So it's a clinical grade device assignment. This device assignment to Mr. Jones, who is the patient, happens in a compliant health IT system by the swipe of a barcode. Mr. Jones, here is device 33. It's a blood pressure monitor. There is a SIM card in it. Go home and measure 2 times a day your blood pressure. So this means that the identity of Mr. Jones as a patient, or any information that would make Mr. Jones identifiable, this remains in the US in a HIPAA compliant health IT system. or in a European system that meets the European regulations. And this is what we call privacy and security by design, because we leverage the compliance, the security, the ability to protect patient data of systems that have been certified to do this. And we are just the, let's say, the IoT postman that seamlessly feeds these systems, and we leave the data protection on their end. What we do, we just transmit the data in a very safe manner, but we never see any patient identifiable information, not even a patient ID. And there is not a single device manufacturer that will get a single patient ID or anything that would make that patient identifiable.
And from a value health proposition, we typically will look at the three metrics, which is better outcomes, reduced costs, and greater efficiency. So this pretty much checks the boxes down the road, right? Because one would assume that by expanding telehealth to folks that wouldn't traditionally have it due to the lack of the smartphone, that will improve their outcomes. Avoiding the cost of an in-person visit and transportation and all those other metrics reduces costs. And then obviously connecting to more people, not having to deal with waiting rooms, it creates greater efficiencies. So this is very much in line with the future of digital health and this value care proposition. Would you agree?
Yes, definitely. So that I think today there is enough evidence via pilots across the world. So some of our partners have really demonstrated that it's cost effective to do remote patient monitoring. So for instance, in France, one of our partner, a company called BWise Health Solutions, they have been a pioneer in remote patient monitoring for over 10 years. They have built their own platforms together with some university hospitals in France. And they really have demonstrated a few years ago on a cohort of 1,000 patients that doing remote patient monitoring can lead to excellent outcomes, both in terms of medical outcomes, but also in terms of lower cost. So just to give a few numbers, they demonstrated that they could reduce almost by 50% the hospital readmissions, which is a huge cost factor. And they demonstrated that they could reduce by almost 50% the mortality rate of the people the first year after they had been diagnosed heart insufficient patients. So both on the cost front and the outcome front, it's a very efficient way to operate. And there are similar research works, for instance, in Germany, La Charité with Professor Köhler has been demonstrating literally the last 15 years with his research in heart insufficiency remote patient monitoring that this is the future. And this is a reason why this year Germany is expected to also introduce, like the US has been doing in 2019, reimbursement code for remote patient monitoring for heart insufficient patients.
And will that reimbursement code sort of break the digital transformation challenge that we've been facing for years, where we all understand this is the future, but getting to that future isn't as easy as it sounds?
Yes, it's a necessary step. In fact, if the doctors don't have a financial incentive to do remote patient monitoring, the startups who have technologies will die by pilots. So yes, every national healthcare system needs to set a signal that if they want, for the next pandemic, to be able to collect vital signs across Europe, for instance, from 300 million people they confine, well, then it would be worth thinking of having a seamless device interoperability with such healthcare systems. There are hundreds of them across Europe alone. And yes, you cannot spend money in too many ways. Money is scarce. And so if you want to set a signal and say that the future is virtual care, then you need to put you need to introduce reimbursement codes that make this shift possible. If you invest in the past, you will remain in the past. If you invest in the future, you will go to the future, you will create it.
Can you, just to shift topic a little bit, can you talk a little bit about your expansion plans? Where are you currently now and where are you looking to move to?
Yes, so what we do is we have built the products between 2017 and 2019. We really had an MVP beginning of 2019. We had a very active support from Amazon Web Services to build our global vendor-agnostic telehealth device cloud, which is really the IoT postman between all those devices and all those systems. And so we had the chance to battle test this device cloud with multiple use cases. So
pre-COVID.
So yeah, so pre-COVID, but it continued during COVID. So to give you a few examples, the use cases we have covered with the university hospitals or in telecardiology, we have clients that are really flagship university hospitals in Europe, like Assistance Publique des Hôpitaux de Marseille. That is the third biggest university hospital group in France. We have the university hospital in Bern, the capital of Switzerland, that also entered the space of doing remote patient monitoring of heart insufficient patients. So these pioneers in remote patient monitoring in the telecardiology space demonstrated that you can deploy a few thousands of devices for remote patients, and that by removing the complexity of the data collection, by making it safer for the data protection officers, it's a very efficient way to proceed. We also had the chance to be part of some European funded projects where we deployed also a few hundreds of devices to patients across multiple countries to do remote patient monitoring of diabetes type 2 patients. It was a project called ProEmpower, funded by the European Union. And more recently, we had the opportunity to win device deployment of cellular-enabled devices from a global research institute for a phase 3 clinical trial across 4 continents. And this brought us our first US customer. And so we are now with the battle-tested product over almost 2 years, both in healthcare and life science, so both in remote patient monitoring and decentralized clinical trials. And we are now at the beginning of the scale-up. And one of our priorities is to strengthen the focus on life science, because we believe that there is more money to grab in decentralized clinical trials, and healthcare will be slower to move. So we are teaming up with companies like Salesforce, that has a very strong base in medtech and life science in healthcare in the US. We integrated into Health Cloud from Salesforce and are looking at going to market with them and serving jointly some customers who are adopting Health Cloud. And we also want to go to the United States because the CPT codes from CMS make it the biggest and the only solvent market in that space at scale currently. But everywhere across the world, there are very advanced considerations to introduce new reimbursement policies for remote patient monitoring. And I mentioned previously that it's really on the table in countries like Germany these months, in France after 4 years experimentation in 2022. And the thinking is there. Now it's just about having the political courage to set priorities. And priorities means you need to do choices. And again, as I said previously, you cannot invest at the same time in the past and in the future. So we will see which countries invest in the future and do the right choices to foster the adoption of remote patient monitoring.
So one of the challenges I would imagine that you're facing is pre-pandemic, you would introduce this product through a series of conferences, and you know, that was taken off the table. It may be returning, but how has that changed your approach to go to market, being that this is, you know, no longer really, you know, or currently isn't a viable option in introducing new products?
Yes, it's a very good point, and I used to spend a lot of time traveling around the world, attending conferences. So we were multiple times at Arab Health. We were very close, for instance, from the Personal Connected Health Alliance, which is the daughter of the device daughter of HIMSS. They organize Connected Health Conference. So we were leading, for instance, the direct-to-cloud activity work group at a global level within PCH Alliance. These led to the Continua guidelines extension from Bluetooth only to direct-to-cloud connectivity to connect personal health devices to clinical backends or wellness backends. And so, yes, I've been traveling all over the place, you know, Arab Health and Boston and HIMSS in Europe and Medica in Germany and CEBIT in Germany and Paris Healthcare Week in France. We have been all over the place. And this stopped overnight with the pandemic. And so we had to be creative. And I think that's why I'm doing this interview with you now. And I think it's a much more efficient way. You know, it doesn't destroy the planet. So my carbon footprint has definitely improved during the pandemic. I think it's a good thing. And we have a go-to-market where we rely on health IT system providers that serve the needs of remote patient monitoring or decentralized clinical trials for their own healthcare and life science customers. And so we have a pretty narrow and efficient route to market. We help those companies that have built those modern platforms we referred to previously. And so we team up with those partners to basically minimize the total cost of ownership of the devices when they get deployed. Because the devices have a total cost of ownership that consists of two elements. First, you have the device acquisition cost, but then you have all the operational costs that relate to the deployment of this device in the field, in the home of the patient during periods that are typically 6 months, 12 months, 24 months periods. And there is no solid facts about the split between device acquisition cost and operational costs, but you can probably take a ballpark number that if you have a TCO of 100, 75 relate to operational costs and 25 relate to acquisition costs. And so what we do is we primarily focus on the bulk of the costs, which is the operational costs. And our telehealth device cloud, through the device management it enables for the biomedical engineers, it really allows to minimize the operational cost over the lifetime of the device deployment. And it removes a lot of help desk costs because we remove the complexity. So if you remove complexity in the last mile, which is the home of the patient, in fact, you remove help desk cost. We also facilitate some triage by nurses. Sometimes patients call and you don't know at the beginning if it's a medical problem or a technical problem. So our device cloud gives a unified dashboard where you have the whole inventory information of the devices across multiple vendors. We also monitor the device health with things like battery levels, signal strength. And as a result, you know, these triaging capabilities we offer to the technical teams avoid to bother the healthcare professionals, the doctors, with technical issues, because there is not a single doctor or nurse, you know, that wants to have a 15-minute anamnese conversation where at the end he figures out that he doesn't have the data from a heart insufficient patient because the patient needs to change the battery in its weight scale.
So what are you facing in the next 12 to 18 months? Where will you focus and what are your plans?
Yeah, so our plan is to keep being obsessed with the customer satisfaction. So we are not looking after growth at all cost. We are not the typical startup that wants to raise $1 billion, and we are rather focusing on winning new customers, new partners who trust us, who want to scale device deployment to keep it simple and secure at scale, and work with them for the benefit of the care teams who very much are interested in doing that, but often do not know where to start. And of course, for the benefit ultimately of their patients that are the main beneficiaries of such a remote patient monitoring approach.
And you said that a lot of this is dependent upon the government's approach to reimbursements. So are you doing anything to advocate for that?
Yes, I talk about it every time I can in panel discussions, just stating the obvious. If there is no money to fund something, the likelihood that doctors who are already overworked, add something on top of the plate that is pretty full already with tasks and activities, these would be it's just a fantasy that this will happen. So yes, it's an area where political courage and wisdom is required from healthcare national leaders. And I'm confident that with aging population, the pandemics, which was an eye-opener, and inevitable economics, if you have a curve of augmentation of the number of doctors that is almost flat, and you have a curve of people that are aging that is pretty steep, there is a gap in the middle, and the only way to make, to keep a level of coverage of the patient in terms of monitoring when they are chronic patients is to go digital. And that's what we enable. And so I believe that the right reimbursement policies are just a matter of time until the political leaders and the people in charge of healthcare policies come to the conclusion that this is the way to go. But healthcare is a slow-moving industry, so it might take 5 to 10 years, depending on the countries. But it's pretty clear that it's not about if, it's only about when.
Well, sir, we very much appreciate your time today and sharing some of your insights. We look forward to following you in some of your advances over the next year or so. We would welcome you back at any time. So thank you for spending time with us today.
Thank you, Mike. Thank you for the opportunity. Bye-bye.